And with that, I would like to turn it over to Jason Robison, who's been a really integral part of the team making this conference possible. Jason is the program director here at SHARE. And thank you, Jason.
Hi, welcome. Thank you, Libby. I can't thank everybody enough for joining us today. We are very excited. This is the Peer Workforce Conference, which is bridging research and practice in peer support. And this project is a part of California's Behavioral Workforce Development Project, which is a project of the California Department of Healthcare Services. And in this project, the California Department of Healthcare Services is supporting 59 grantee organizations in scaling the peer workforce in both behavioral health, substance use, peer support across all areas of peer support. So, you know, person to person, family to family, parent partner to parent partner, and California is also developing specialty peer support certifications through its new SB 803 Medi-Cal peer certification, which is an exciting development in California. It's a long time coming, but California is now on a pathway to have statewide certification for peer support. And as SHARE is a partner in this project with DHCS, Advocates for Human Potential, and CAMPRO, when we looked at doing this conference, we really wanted to bring all of the grantee organizations together. We wanted to bring their expertise, and we wanted to connect them to the broad community of researchers and practitioners around the world who have been elevating best practices in peer support and recovery for decades. So this is another partner in this conference is the Society for Community Research and Action, SCRAW, which is Division 27 of the American Psychological Association. And these are the institutions, the individuals that really look at community, that look at recovery, that look at peer support, that look at self-help support groups. And I am excited to have everybody here today. And right now, I want to introduce Ilana Rube from DHCS in California, who can just say a couple things. We wouldn't be here today without the leadership in California at the Department of Healthcare Services. So thank you, Ilana, and thanks for joining us.
Thank you so much. Thank you for having me. It's so exciting to be here at the beginning of your conference. Everyone looks so fresh-faced and ready to participate all day long in wonderful sessions. I was looking at the agenda, and it's really an incredibly packed day that you all have, and I would have a very hard time, I think, picking between some of the sessions to attend. So I look forward to probably looking at some of the recordings later on. But thank you so much, everyone, for joining. It's so wonderful to see the fruits of all of these efforts coming together. DHCS has been very excited about all of the funding that we've been able to provide to peer organizations through the PWI and the EPIC grants. And to see such hard work from SHARE and partner organizations to provide the training and technical assistance to really elevate our peer workforce across the state. So we have been we've been developing the granting programs for the statewide development of the peer program, and we are going to continue to do more granting programs across behavioral health systems for behavioral health workforce development in California, in the hopes that everyone is ready for the rollout of the SB 803, the peer certification, and the peer as it's a statewide certificate. We look forward to all of the hard work and seeing everyone's faces at multiple conferences and future events, and all of your hard work paying off to really elevate our statewide peer workforce. We want to thank you all for your participation, all of the work that you are contributing. We know that this has been a very long road for many of you, especially, people who have been with organizations that have been working very hard to see the growth of the peer workforce and to see it really elevate and to get the recognition it deserves as a statewide benefit and as a statewide position. So we look forward to all of your hard work continuing to pay off and to see how it continues to develop. We look forward to hopefully more granting opportunities in the future and to really work together as we continue to move forward with this benefit. So I hope you all enjoy a wonderful day. We are so excited that you could be here, and from DHCS we are really grateful for all of your hard work, and we look forward to seeing all of it pay off as we continue to move forward. Thank you.
Thank you, Ilana, and thanks again to DHCS. I can't emphasize enough how transformative the last year has been in California with the support of DHCS and really the direction of the state in elevating community-based supports and peer services in a recovery model. This is the explicit direction that California is moving in. And in that effort of elevating the peer workforce, we are committed to bringing together best practices and to bring together, to put research into practice, which is what we're all about today. So I'm gonna be quiet and I'm gonna let you find your way to the program, the presentation that you are most interested in for the first session. But welcome everybody, and it's so good to see everybody. Thank you for joining us.
Can everybody hear me okay? I'm just testing out my mic here. Great.
So Jason or Christina, or this is Rita, we're going to need to be made co-hosts for the presentation.
Okay, yeah, well, when we get into the room, just bring that up.
We're in the room. We're in the room. We're in the room.
Are we? Okay, let me do that.
You're in our room.
I'm in your room. Let me see if you're let me see if I can do that.
I got you. I just made you a co-host, Rita.
Okay.
And then we got Amy.
Yep, Amy needs to be made co-host as well. Thank you.
Got it. All right, you should be good to go. Did you want to do questions at the very end? Sorry, I missed that.
What questions were you talking about?
Just for the conference, did you want to wait until the very end and just have people raise virtual hands?
We were hoping to have somebody manning our chat, but she had an auto accident yesterday, so
Oh no.
able to join us.
Okay.
So if our tech person can just alert us if there are questions to answer during, that would be fine. Otherwise, we do have a section at the end for questions and answers too.
Okay, great. I'll keep an eye on the chat. And do you want me to just send you a DM or maybe just interrupt real quick if there's anything?
Yeah, it depends on which of us is presenting, because I'll be sharing my slides, so it's not as easy for me to see the chat when that's happening.
True.
You can send a direct message to Amy.
Okay.
Yeah.
Sounds good.
So does the screen look good? All right, thank you.
I'll do a quick introduction. I'm just waiting until 9 o'clock to make sure we get everybody in.
Sounds great. Thank you. I'm just going to make a note in the chat that this is where it starts. Otherwise, they're going to see all of the chat from before of who was here, and we can't really take credit for that. So I'll just add that to the chat right now, if that's okay.
Go for it. Okay, it is 9 o'clock, so we can get started here. Hello, everybody, and welcome to the Bridging Research and Practice Conference. I'm Kathleen, and I'm with Share. This session is research into effective telehealth peer support. And today we have Rita Cronise, an instructional designer with lived experience of a major mental health diagnosis. She's been an advanced level RAP facilitator, certified peer specialist, and peer specialist trainer in the VA, and led the development of SAMHSA-funded Recovery to practice advanced peer specialist training. We also have Amy Spagnolo, who is an associate professor in the Department of Psychiatric Rehabilitation and Counseling Professions at Rutgers, the State University. In addition to teaching and administration, her experience includes over 20 years of curriculum design, staff training, and consultation for the behavioral health sector. As you know, everything is being recorded, and the presentations will be available at a later time. If you have any questions or technical problems, please go ahead and send me a message. Okay, it looks like somebody doesn't hear me very well. Can I get a thumbs up if y'all are able to hear me? Okay, I see a thumb, great, great. Okay, I'll try and speak up a little bit for those who can't hear me. So at the end, there's going to be a section where you can ask questions. And I'm going to turn it over now to Amy and Rita. Thank you so much.
Thank you, Kathleen, and we're delighted to be here. So I'm Rita, and Amy is waving too. I'm hoping that if you could possibly turn your video off when you're not speaking so that we can keep the video for those of us that are presenting, that would be great. Helps to save on bandwidth as well. So welcome, we're so glad that you're here. And again, Amy and Rita, and we were supposed to be joined by our end user support specialist, Mariam Hassamuddin, but she had an auto accident yesterday, so she's not able to join us, unfortunately. She was going to manage the chat, so we may need to do a little bit of readjusting to make sure that we're able to hear and see all of your comments. But what we'd like you to do to begin with is to just let us know, and this is also a request from Share, your name, your hometown, your city, your state, and your organization, and your role, what role that you play. And use the chat to ask questions. Kathleen said that she'll try to flag us down if there's any questions that you have that we can answer along the way. Otherwise, we will have a question and answer session we're planning at the end of the session. So again, I'm Rita, and we'll get going. So the objectives for today, after viewing this presentation, you should be able to describe how the telehealth peer support competencies were determined, identified using a survey of importance, frequency, and criticality. You'll be able to identify the core competencies of peer support that were confirmed through this study, and you'll be able to explain the strategy and process for developing the telehealth peer support training that we did following identifying those competencies. Just to set a little bit of context, we are with the Academy of Peer Services, which is the training and testing and tracking platform that we use in the state of New York for the certification of peer specialists in mental health services. Through the generous support of the Office of Mental Health in New York State, we've been able to develop this online platform for delivering training and testing for the certification. It's a first step towards certification. The full certification in New York requires 2,000 hours of supervised work experience taking courses on our platform. But here's a little bit more about what we're about. We've been successfully running the Academy of Peer Services for 10 years now. Each term, and we have 3 terms per year, each term we have over 2,000 learners that register each term. We have over 20,000 annual course registrations. We have a 15-member advisory council of people who all have lived experience of mental health conditions, and often also are providing peer support service or supervision of peer support specialists. At this point, we now have, and we just checked this again, yes, it's almost unbelievable to us. We have over 90 online courses in the Academy of Peer Services, and we have over 70 subject matter experts from across the country, and many of them are nationally recognized subject matter experts who work with us on the development of our courses. And we also have, which is my project, is the virtual learning platform, where we have a website and a number of activities that are going on in the virtual learning space to keep people up to date and up to speed on the latest that's happening in peer support. We have over 50 volunteer learners that beta test our courses whenever we launch something new, and often when we're relaunching courses because content changes, new updates are needed. We have gone through a number of extensive revisions recently on some of our courses, and we have learners from the Academy that help us to verify that. If you could put yourself on mute when you're not directly speaking, that would be great. We are a women-run team of 5 that are directly staff of Rutgers University, because the program is managed by Rutgers University through the support of the Office of Mental Health in New York State. And we work in close partnership with the New York Association of Rehabilitation, Psychiatric Rehabilitation Services, or NIAPRS, which many people are very familiar with NIAPRS as an organization. And Mariam, who is our end user specialist, is a NIAPRS employee who works specifically with us. We represent a diversity of ethnicities and ages. And again, we have over 90 free online on-demand courses as part of the Academy. 13 of them are the core courses that constitute the peer specialist training for certification. After completing those core courses, people can submit for a provisional certification, which in New York allows people to begin working, either working volunteer or in an internship, or working towards the 2,000 hours of work experience that's required for certification. We also have 28 elective courses that apply towards continuing education. We have 44 continuing education courses that are being adapted from webinars, which are current events and current topical areas that are under request. And we have 2 supervision track courses and 3 non-credit development courses. And again, we have Mariam, who's our full-time user support specialist from NIAPRS. So Amy, if you could pull this from the slides. This is how you can access the Academy of Peer Services through our website. You can contact Mariam directly, our user support specialist, through this email address. And my virtual learning community is available through these website addresses. We also work collaboratively with a group called the Goodwill Community Foundation, and this will come in a little bit later in the presentation when we talk about very basic computer skills. Goodwill Community Foundation has an amazing array of wonderful courses that are video-based and tutorial-based that cover basics of computer skills, workplace readiness skills. There's a number of great courses that we have worked with them to develop that are also available for credit through the Academy of Peer Services. Part of what we offer as part of our contract is a needs assessment of certified peer specialists, supervisors, and trainers. We have a community of practice of certified peer specialists and supervisors, which is part of our annual deliverable. We're working on a training support network so people can take our online courses and bring them into classroom training, instructor-led training. So the online courses become the basis for learning, and then the actual interactions happen in the classroom. There's a lot of groups that are offering classroom training now, either live or in person, when the pandemic subsides. And then we do a lot of course prioritization, development, and revisions. And we also, all of our courses are compliant to 08 accessibility standards. So these are just a few tips about the Academy of Peer Services. The one thing about the Academy is it's all open source, which means that all of our training content is free of charge to anybody, really anywhere. And that means that we cannot put proprietary information on the site. And that came into play when we started looking around at how we could bring in telehealth peer support training on the Academy. There were a couple of proprietary training vendors that would, that were available, but they were not available to be put onto the Academy of Peer Services. Our courses are available online and on demand, and they're available anytime during our open terms. We have 3 open terms per year. And we have some courses that are available year round. But the fact that we're open source is what really led us down the journey of having to develop our own training for telehealth peer support. And with that, I'll turn it over to Amy Spagnolo to talk about how that happened.
Thanks, Rita. So I'm going to spend a couple of minutes with everyone describing the process that we used to better understand the delivery of telehealth peer support in New York State. And many of you on this workshop may have had lots of different types of experiences delivering peer support during the early stages of the pandemic and probably consistently over the past 2 years. So the telehealth peer support survey for peer support specialists and managers was developed using the Delphi method for survey construction. And the reason why we chose a Delphi method was because it's particularly useful in areas of limited research, since survey instruments and ideas can be generated from this knowledgeable participant pool. And the Delphi method is also suited to explore areas where controversy, debate, or just a general lack of clarity exist. And that is what we were finding when it came to the specific competencies of telehealth peer support. And so this method ensured that we had expert guidance, in the development of the actual survey items and in the continuous multi-phase review of the actual survey items. So the first part of this process, round one of the Delphi method, was we convened a group of stakeholders to address the potential digital divide among members of the peer support specialist workforce and also people who are receiving telehealth peer support in New York during the winter of 2020. And as a result of those discussions, a list of broad topics related to the delivery of telehealth peer support that we believed required further investigation was developed. And some of the topics that came through this Delphi process were the minimum competencies for providing telehealth peer support, the primary outcomes that were expected or desired for telehealth peer support engagements, the variety of resources to support peer workers in offering telehealth, the technology barriers that were experienced by the peer support specialist workforce, and then finally, any additional resources that were needed to better offer telehealth. And so that was a comprehensive list that covered these various topical areas where we then used to develop the telehealth peer support competency statements in conjunction and collaboration with the experts. And so that stakeholder group reviewed them and were able to make additional comments and edits for us. Next slide, Rita. So the survey of telehealth peer support is where we're kind of thinking about this as round two of the process. So the researchers engaged members of our 15-member advisory council to further explore the categories that were identified in phase one. And the group of review participants, or what we called panelists in this Delphi method of survey construction, worked with us, and they were included for their expertise on the topic of telehealth peer support. So in collaboration with them, we were able to develop the actual survey items. And in round three, the research group conducted 2 sequential rounds of item review based on these 5 broad categories for investigation with the panelists and other groups of trainers that were employed by our collaborating organization in New York, NIAPers. So the items were presented for feedback, and state and regional advocacy specialists also weighed in. So this iterative process ultimately influenced the survey and each of the items, and it resulted in 2 parallel surveys that we disseminated online. The first was the telehealth peer support survey for peer support specialists, and the second was the telehealth peer support for managers and supervisors of peer support services. And they were, as we said, nearly identical. Next slide, Rita. So the surveys themselves were comprised of 9 demographic items, and that was to describe the respondents who completed the survey. And the telehealth peer support competency statements identified in the multi-phase process I described earlier translated into 27 survey items. And those were then evaluated by respondents based on their importance, the criticality of them to the work, and the frequency in which the telehealth peer support competency was used. And those were rated on a Likert scale, from 0 being lowest, 4 being highest. The survey had some descriptions in there too for the respondents. So a competency was described as a critical work function or task. The survey went on further to state that competencies are defined as knowledge, skills, abilities, behaviors, and other characteristics that an individual needs to perform in their work role. And importance was defined as an important task performed by a peer support specialist in the delivery of telehealth. Critical meant that if the peer support specialist didn't demonstrate the competency, actual harm could be caused. And frequency referred to how often the peer support specialist was demonstrating this competency in the telehealth environment. The 27, Rita, could you mute the participant who's live? Thanks. The 27 telehealth peer support competencies were then organized into 5 categories. The first was outreach and engagement. I'm going to take a quick pause and see if I could do some muting, or if Rita could.
I just muted some people.
Thank you. So the 5 categories were outreach and engagement, communication techniques, providing or linking to needed supports and resources, documentation and technology, and then wellness promotion and health literacy. There was a third section on the survey, and that was 9 items that evaluated what the most important outcomes of telehealth peer support engagement was, as well as the quality, type, and frequency of supervision. We were really interested in hearing about how peer support specialists were receiving virtual or telephonic supervision during the earlier days of the pandemic, and just trying to kind of track the frequency and the type of supervision people were getting. And then finally, the last section of the survey included 5 items that related to the types of technology support peer support specialists were given to provide telehealth, some of the technology barriers that they were experiencing when providing the service, and then additional items on access to technology and what peer support specialists needed now to best deliver telehealth. And so those online surveys were distributed through multiple methods across the state, through professional organizations, the Academy of Peer Services, the virtual learning community, the Office of Mental Health, and then some of our community collaborators and provider organizations. So there was pretty broad dissemination. Rita, we can go on to the results. So in terms of the usable responses, which meant the participant answered all of the questions, we had 313 peer support specialists respond. And that number represents a little over 10% of the approximately 2,900 credentialed peer support specialists in the state. We also had 164 responses from managers and supervisors. And some of the main findings that we got from this survey was that approximately 20% of peer support specialists reported that they themselves experienced low technology skills. About 20% reported that they still needed access to hardware. So things like laptops, desktops, tablets, smartphones, and cell phones. Nearly 20% still needed adequate smart or cell phone data and minute plans. We also found that the need to access software like Zoom, WebEx, Teams, and other video conferencing was reported by over 20% of the respondents. About a quarter needed financial support to access the internet, and nearly 1/3 needed access to secure servers for compliance and security. When we asked where peer support specialists were accessing the internet currently, over half indicated from their homes. About 40% said they were still getting internet at their office and they were allowed into their offices. And less than 2% were accessing the internet on their phones only. In terms of resources, both peer support specialists and the managers identified resources that organizations have provided, as well as the additional resources that peer support specialists still needed. So 1/3 of the respondents indicated that peer support specialists still needed training on the actual skills to deliver digital or virtual support. And approximately 20% of the respondents needed live technical support from a technician that they could call or access online when they were experiencing difficulties connecting. 1/3 still wanted, as I noted, a smartphone, and they also required access to a learning community with other peer support specialists who were offering telehealth at the same time to kind of discuss strategies and tackle some of the barriers that they were experiencing connecting with people in their communities using virtual or telephonic methods, which seem to be a pretty persistent issue over time. So Rita, we can go to the next slide and kind of wrap up this part. In terms of the competencies of telehealth peer support, we recognized at the beginning of this research that the COVID-19 pandemic and the resulting stay-at-home orders had greatly increased, the use of virtual, digital, telephonic services that were being delivered by peer support specialists in every state, widely delivered by these webcasting platforms or the telephone. The services quickly became known as telehealth peer support in our state of New York. But there were no standards or competencies defined and tested in the literature specific to telehealth peer support that we could consult to provide training. Additionally, there was no published literature on things like access to technology, required technical literacy, skills, hardware, software needs, etc. And even though many of the organizations around the state began returning to this traditional face-to-face behavioral healthcare work, the need and the desire for telehealth remained. And so people were requesting the continuation of telehealth, even when many people were returning to the face-to-face setting. We also found that that was especially true in rural areas where traditional face-to-face services had historically posed barriers to access for people. So it was really essential that the survey results informed the development of training that we ultimately offered to peers in New York State around telehealth peer support. So we wanted to just leave you kind of with an overview of what those competencies are, and just share the fact that this training is offered as a free open source product for peer support specialists and peer support organizations across the country. So if you were interested in delivering telehealth peer support training, you could access the materials developed by the Academy and use them with the peer support workforce in your organization. So Rita, let's look at the first category, which was outreach and engagement. We see that this first category is based on 3 competencies, again, that were identified in the survey. Just as a reminder, the peer support specialists and managers rated these on importance, criticality, and frequency, and the resultant categories are what appear on the next few slides. Rita, you can take us to category 2 for communication techniques. There are 7 competency statements that make up this category. And I will just note that one of the results we found was that demonstrating empathy was the most highly rated competency among the peer support specialists that responded to this survey. Category 3 on the next slide was providing and linking to needed supports and services. That was comprised of 6 competencies. And then the next category was documentation and technology, comprised of 5 competency statements. And then finally, we had the 5th category, which was wellness promotion and health literacy. Again, this one was comprised of 3 competencies. So just what I'd like to leave everyone with in this last part of the summary is that unlike programs that were established prior to the pandemic that sought to create these technology solutions that would supplement or enhance peer support, this study was, the meaning was to examine the competencies required for the effective delivery of telehealth peer support, and then to rate those specific competencies on importance, frequency, and criticality. And so as telehealth policies and procedures are being issued and codified across the country, based largely on telehealth practice that's been delivered by licensed clinicians, there's a significant risk that elements of peer support may be diminished or lost. And so in this study, we made an intentional effort to identify through this expert consensus by peer support specialists and their supervisors, the actual competencies and the performance-based supervision that helps to preserve this unique nature of peer support services in this developing world of telehealth peer support. And so we recognize that more analysis to reveal how closely these telehealth peer support competencies are aligning with the recognized standards of peer support should be conducted. And we are absolutely committed to kind of seeing that research through. So I truly appreciate your attention. I know this was dense statistics and a lot of information. I will end by saying that this has been, the project has been accepted for publication and will be hopefully out next month.
I can show you my work, for real.
Amy, you're muted.
Any
You're muted again.
Anybody who's interested in that publication can reach out to us via email and we'll share the details. So thanks so much. Rita, back to you.
Thank you so much, Amy. It's a lot of work, and it was an amazing study. And what I'm going to talk a little bit about now is, after we did the research, then what? And how do you take the needs that were identified in the survey? How do you identify the competencies that were identified in the survey? And how do you bring into it the real world of what's happening during the pandemic in peer support? So this is just a little bit about our approach to the training, design, and development, but it only really scratches the surface of what the people who were involved actually put into this training, design, and development. So here was our development strategy. Knowing that the collective of peer supporters that are out there doing peer support through telehealth methods, having all of them share and pool their resources and pool their knowledge and put together the things that they were learning in a collaborative learning environment was probably the best way for us to get maximize the benefit of the experience that they had gained over the time during the pandemic. So our strategy was to do a telehealth peer support learning collaborative. We had trainers that were recruited from our pool of people that were experienced providers, both in peer support and supervision. We developed some standard templates for them to use to do the instructional design and creation of the course content. The learning collaborative was delivered by Zoom. We had about 40 people per session because this was by invitation. There were many more people who were interested, but we wanted to keep it narrowly focused on a group of people that could have a rich dialogue about what they were doing and then have smaller groups discuss how they were doing it. The virtual sessions were then recorded and they have been adapted for delivery through the Academy of Peer Services. And continuing education has been approved through our New York State Certification Board for these courses so that they're available for continuing education for anybody who's working towards full certification or renewal of their certification. This is just a real quick glimpse at sort of the standardized curriculum design template that we used. We started with what were the needs that were identified from the survey and the content competencies that were identified during the survey. We then gave each of the trainers a different segment to work on, and a trainer would then do the goals and objectives relevant to that competency, resources that were available, and they would also develop a quiz because we have quizzes that are required to pass the tests on the Academy of Peer Services. So we had trainers that were working in the competencies of outreach and engagement, in communication techniques, in document technology, in health literacy and wellness. So each of the different content areas were developed into a large course, and then each of those courses were delivered partially as a presentation and then as small group activities. So our standard agenda was the session title, the trainers for that session, again, the description, goals, and objectives of that particular session. And then each trainer, we actually had co-trainers, or in some cases, three trainers available that would divide up the content, deliver the content, and then develop the small group activities that went with each one of the sessions. And these standard agendas would include instructions for the small group facilitators. We would have between 5 and 7 small group facilitators to facilitate those small groups. And then we would have standardized handouts too for the participants to take away. And these would include questions for reflection. So after a session, you can kind of reflect on, what did I learn in this session? What can I do differently in my own work based on what I learned in this session? And these standard templates can also be used by organizations who take things off of the Academy and want to customize what's on the Academy for their own training for telehealth peer support. So these handouts and templates are available for anybody in organizations that want to take what we've done as a basis for developing customized training for their own organizations. Again, we had standardized presentation slides, and we had a robot theme to kind of make technology friendly. This was just the Learning Collaborative announcement that went out to those that started attending in September of 2020. And the invitation was to selected participants who were identified through our Academy of Peer Services Advisory Council. One of the things that was identified as part of the study and the survey was there was still a need for people to understand basic computer skills. And if they didn't need it for themselves, they needed it for the people that they were supporting, because so many people that were being supported by peer supporters just lacked really basic computer skills. And we identified and started working directly with a group called the Goodwill Community Foundation. They have over 200 courses that are short YouTube videos with accompanying tutorials that take people through basics of, like, what is a computer, how to avoid malware, how do I get on the internet, just some of the very basics of being able to use a computer. They're very short and very easy to follow courses that are available online, again, free of charge. Everything that we offer has to be open source and free of charge. And we got permission from Goodwill Community Foundation to take the certificates of completion from their courses and put them through our Academy of Peer Services, our certification board approved, the ability for people to take 5 of these courses in basic computer skills and get continuing education credit towards the renewal of their certification through these courses. And then we had interns that were offering these courses on a lunch and learn basis for people to learn basic computer skills, or to be able to then take these computer skills and then offer them to others that they were trying to support through basic computer skills. It's been a wonderful partnership. And this is just the flyer for our basic workshop that was a lunch and learn based on the Goodwill Community Foundation Global Learn courses. Our interns did lunch and learn series on Mondays, Wednesdays, and Fridays. And that will be continuing with our next round of interns that we start with. And part of every one of our sessions, we had an opening segment at each one of our sessions and a closing segment at each one of our sessions. The opening was by Celia Brown, who is one of the most recognized peer supporters, at least in our state. She was the first peer supporter that was hired through the civil service job title for peer support specialist. And so she would open the session and we would talk about, Celia and I had many conversations before we even started this research study of how the heck are we going to get people up to speed and online when they need to be, when people just lack these basic computer skills. And we had even started to develop and craft a basic computer skills training when we came across the Goodwill Community Foundation, and it was already done. And we reached out to them and they said, of course you can use our courses. That's exactly what they're there for. So that was part of it. So that was the beginning of our sessions. And at the end of our sessions, we had Mariam Hussamuddin, who was our NIAPRS end user support specialist with the Academy. She does a lot of tech support with all of our Academy learners, talking about the wisdom that she's gained through just the job that she has with offering emotional support to people, offering reassurance to people, offering people the idea that you can do this, you absolutely can do this. It just takes a little bit of understanding and practice. And it was very much peer support in the realm of technology. And so she would come in to every one of our sessions at the end of the session and give a little bit of a summary of what was talked about and how what that looked like when she was giving. I can't give you the benefit of her wisdom right now. I wish we could. She would have been here, but she had a car accident yesterday and we just are missing her. But she just has a lot of wisdom, practical wisdom, and very uplifting and encouragement, and really doing the core competencies of peer support through the user support specialist position at the Academy. And so I'm looking at the time. We wanted to sort of see where we were at with time. Amy, what do you think? We've got about 25 minutes.
Yeah, I think that it would be great if we could do our breakout for about 8 to 10 minutes, Rita, so that we can come back and process.
That sounds great. Oops. Uh-oh, I missed. I'm going to put in the chat, but here's basically what we were thinking of our breakout. In each one of our telehealth learning collaborative series, we would have breakout sessions that would tap into the basic theme of what we were talking about for that particular session. And because not all of you are necessarily peer specialists, but all of you have probably been touched in some way by the pandemic and the need for using remote access, including today's webinar or today's conference. The question that I'd like us to do, and I'm going to put us in breakouts so that we'll be paired up with one other person. So you'll just be sharing with one other person your thoughts on what have I gained because of the pandemic through the ability to connect through technology. So communicate or connect through technology. What have I gained? And I'm going to go ahead and put that in the chat. What have I gained through the pandemic in, what did I just say? in
Okay, yeah, look on the stove.
reaching others through technology. So what I'm thinking of is, for example, and I'll just use the really obvious one because we're all here, I've been able to join a conference where people are coming in from all over the country and actually in many cases all over the world. So that's one thing that I've gained. What else have we gained? And so I just need to find my controls. So I'm going to put us into 40 breakout rooms. You may have one other person or you may have two other people, but over the next 5 minutes, just discuss the question, what have I gained through the pandemic by access through technology? And so we'll go for about 5 to 7 minutes talking to each other, and then we'll come back and I'll have you put the things that you came up with in the chat when we come back. So I'm going to create the breakout rooms and just go ahead and join. If you see the invitation, if you don't see the invitation, you may need to look at the bottom of your screen. There's 3 dots and a more, and that may be where you'll see where the breakout rooms are if you're not seeing the breakout rooms. And I'll make sure that we've got somebody in each one of them.
Rita, no one's with Mary in room 9.
Yeah, I'm going back through the list right now to try to move people.
Great. Yeah, if somebody is in a room with another person who's not paying attention to their screen, they'll be with no one.
Yeah.
Okay, so if you're still in this main room, you should have received an invitation to join another room. Hey, Mary, we see that you were alone in yours, so I'm guessing that's why you popped back into us. So we'll move you into another room shortly. Anybody else who's in the room should have received an invitation. So if you click on the box in the bottom of your toolbar, it says invitation, and that should get you back to where you can go.
Yeah, I think I'm getting everybody lined up. Looks like I've got 2 people in almost all of the rooms now.
Can I try my breakout room again?
Sure. Who was that? Who spoke?
Mary, it was Mary. Hi. I don't want to be disruptive, so I'm trying not to talk.
Oh, that's all right. That's okay. Some folks have not accepted. That's why you're kind of out there by yourself, Mary. So let me just find you from the list and put you in a group.
Okay, perfect. Thank you.
Yeah, you're welcome.
And you did ask us to keep our videos off, correct? For bandwidth? I was
When we
pretty,
were,
Oh,
yeah,
you could actually turn it on in the breakout room. I'm sorry, I should have mentioned that in the breakout room, it's nice to have the ability to see each other.
I was going to the breakout room because it'll be intimate, but for the main session is what I meant. I heard.
Oh,
Yeah.
right.
I'm pretty tech savvy, so I'm all right. I kind of get that.
Rita, do you see
Not tech
Mary?
savvy, but a little bit. I'm familiar with Zoom.
Mary, I'm sorry, Rita, do you see Mary on the list?
I was in breakout room 9, but there was nobody in there with me. Sorry.
Okay, I see Mary. Thanks.
Thank you.
You got it. Okay, so Christina, Sunny, Terry, Adrian, Margarita, Brian, Sandy, are you folks able to join the rooms that you've been assigned to?
I'm having trouble signing into the room. I don't know why.
Okay, Brian. So I think that I heard Brian's voice say he had trouble going into his room. So let's try and offer you that invitation again. Okay, Sandy doesn't have her camera or microphone set up. Okay, no problem, Sandy. When you come back, you'll be able to hear others describing how their breakouts went. So it's not a problem.
There was no one in my breakout room.
Hi,
Her-
Lenita.
Hi. We went there, but she has the mute and no video, so no one ever came on.
No
So
worries. What group were you in? What room were you in, Lenita? Do you remember?
13.
13. I see you. All right, Lenita, I'm just going to pop you into room 14.
Okay, thank you.
Yeah, you got it. You should get that request. Okay, if anybody else needs some help being directed into their breakout room, just please let us know that and we'll be able to move you over.
So I think I'm going to give 2 minutes, a 2-minute warning.
Yeah, that sounds good.
So
Yeah, we should just let people know that if they were not able to join a room or they entered an empty room, we're sorry about that.
yeah, my hope for the recording was that we'd have a few people hang out here that we could just talk about. So what did you gain through the pandemic in using technology to connect with other people? So why don't we just talk about that while we're waiting for people to come back, and I'll keep an eye on the time.
Sure. It's too bad that Sandy is not connected via microphone because she had a really good point. As a supervisor of a peer-run wellness center, I had to quickly learn how to utilize Zoom to connect with our members. I think that she describes a very common feeling among supervisors and providers during that time was, what the heck is Zoom? And how are we going to get people connected?
Yeah. Hi, Lori, did you have something?
I thought we were coming back. It said in 2 minutes, so I left. We left the room.
Oh,
Oh,
okay.
okay.
So we're done.
Good. I think it's probably just about time to close the rooms because it was, yep.
59 seconds, Rita. I think everyone got the warning.
I'm gonna stop sharing for a moment here too. So I don't know what the heck happened to the instruction slide. It must have been the last version that I put up before we
Oh, that's all right. You were
version
able
control.
to share it in the chat.
So welcome back as you rejoin us. We just wanted to get a few thoughts about what you discussed in your rooms, and you can either do it through the chat or we'll have you just raise your hand. You can either raising your hand using the reaction is the best way to do it. There's so many screens, not always easy to see everybody who's raising their hand, especially if you're not on camera. But if you can use the reaction button down at the bottom of the Zoom screen and raise your hand if you want to share something. Otherwise, please do feel free to just put something in the chat that you talked about that was just something you got out of having lived through this pandemic and the ability to connect through technology.
We're back.
Okie dokie.
All right. I was just giving the instructions. So if you could just either in the chat mention one thing that you got out of having lived through the pandemic, what you got out of technology as a result of that. Or if you want to raise your hand, I can call on a couple of you to share we have about 5 minutes that we could just have a few people report out on what they talked about in their room. And so go ahead, Daniela, if you want to come tell us a little bit about what you heard.
Okay, so Laura and I spoke. We had a great little conversation, but one thing that came out of the pandemic that we talked about is some of us had had a sense of isolation for many years, and the pandemic was a leveling field because all at once everyone's isolated, and then we could reconnect with people in these virtual spaces. So I think from a behavioral health perspective, that was really unique to me during the pandemic.
Fantastic, thank you, Daniela. So I've got Dwight, Zofia, and Camille, and Caitlin, and that'll probably be about as many as we can take with live report outs, but please do put anything in the chat that came up for you. Go ahead, Daniela. It was you just spoke, Daniela. Go ahead, Dwight.
Good morning, everyone. My big challenge in 2020, I had just finished my peer support certification. So coming into the pandemic, I didn't have a lot of computer skills, so I had to learn to download Zoom, work Zoom, different other virtual apps. And I think it became more of a challenge, but it came a part where we bridged with our members. Even though we couldn't go out to the houses and see them, we told them, look, this is a benefit. We have to see you on camera. You know, you can tell us you're okay, but we want to see your face. And that kept us to have communication with them. And that's how we supported our culture. And we also had a telehealth challenge through my company. So we made it more appealing where people would reach out to more people and got a prize at the end of the week. So it was a big challenge. Thank you.
Thank you so much, Dwight. Sophia.
Hi, so I talked with Jody. So we just talked a lot about just how many more people you can reach online. And also just how nice it is to be able to work from home and do everything from the computer. I got hired during the pandemic, so I have no frame of reference for what it was like before, but I've really liked it so far. Jody works more with adults, and since I'm a youth, my work is more youth oriented, but we found that like across the board, we've gotten a lot out of like just doing things digitally.
Thank you, Sophia. Camille.
Hi, I was partnered with Brendan. I supervise a lot of peer specialists at different locations. So us going online made it really easy for me to be able to have contact with all those people without having to drive to a lot of different places. And also I work for SHARE, so we have online self-help support groups, and we We are having people from other countries that haven't heard of the type of support groups that we have before that deals with a really critical issue that they're dealing with, and now they have access to it. So that was really wonderful.
Wonderful. Yeah, thank you. And Catalina.
Hello. The one thing that being in the pandemic that we realized, well, I think we kind of forgot within the trans community and advocacy within that community was that there's a lot of people that aren't comfortable enough to be in like in-person groups or in-person type of events. And the one thing that we kind of realized was now having to start Zoom meetings and on computer, was that now we had the opportunity to reach out to this community of trans individuals who were finally able to be around their community without fearing being outed. Or if they weren't able to present or transition in public, they were able to at least show their true selves or present on a Zoom meeting. And it was a way for them to kind of be like, okay, I can do this. I'm not ready to be in public yet, but at least I have this meeting during the week that I can, meet with these people and I can feel like my true selves. And it was kind of awesome to see a lot of them at least have that to hold on to. So it was kind of cool. So
thank you so much. And again, I do apologize if we didn't get you paired up during the breakout session. We were working with the technology, but we were really hoping to have opportunities for pair shares. So take a look in the chat, add in the chat your own ideas about, if you weren't able to talk to anyone directly, just go ahead and add your own ideas about something that you gained through the pandemic. And we did find a lot of positives that came out of our training. So I just wanted to go ahead and share that as well. So I'll come back to our presentation. Oops. And now we're to our question and answer session. So if you have any questions, if you could put that in the chat, or you could also raise your hand. I'll actually stop sharing again so I can see the hands raised. If you've got your hand raised and you don't want to ask a question, go ahead and lower your hand. If you have questions in the chat, we'll take a look at that. Can you
Rita,
have a copy?
There's a couple of questions about whether or not participants in today's session would be receiving the PowerPoint slide deck. I believe we can share that as a PDF with the conference organizers, and then perhaps we should check in and see how participants then get it. I'm not sure if we have our share representative with us still to ask that question, but we'll find it out before the end of the.
Yeah, Kathleen is here.
Yes.
So.
Yep, I'm here.
Okay,
Yep.
sorry, Kathleen, I couldn't see your picture anymore.
I'm here.
Yeah, and we definitely will provide it, and it will probably be available at the same time as the recording. I think that's what Libby said yesterday during the session.
Yes, I believe that's correct.
Okay, great. So there's a question in the chat from Aviva. So Rita and Amy, beautiful job as always. Thanks, Aviva. Just to play devil's advocate, do you think that by disseminating the survey online, there were any gaps in representation of those less comfortable with technology and email? For sure. So Aviva, one of the limitations of our survey was that it was online based. And so if people couldn't connect at all, they would have a hard time hearing about the survey and then completing it. However, we did send out information about how to access the survey in its paper and pencil version, and that we could mail it to folks at their home or their work addresses, and that we also would provide live technical support via telephone for anybody who needed help completing the survey. And that meant we can either read the questions aloud and record them ourselves to enter them into the database, or the person could, circle the answers that they wanted to and then send it back. So we tried to minimize that problem, but I'm sure there were people who were kind of blocked from doing it because they didn't even know about it. Great question, especially for the research angle. Thank you, Aviva.
Yeah, thank you.
Can you speak to the alternatives to face-to-face instruction, RE practice methodology used to teach, coach individuals just learning to use technology? Oh, John, that could be a whole workshop, and I'm obsessed with the topic. So I
Yeah,
could
so
talk.
am I, and I'm not looking for answers. I just thought I'd shoot because you all seem so knowledgeable, and I was doing the Snoopy dance during your presentation. But you know, we've had some alternatives. I'm going to zip it now. I'm not looking for the skies to part and rainbows and unicorns, but this has been one of the crux. So thank you.
Yeah. So the alternatives to face-to-face instruction is really what the Academy has been based on. In New York State back in 2010, prior to the practice standards for peer support even being released by SAMHSA, or the important naps of work that was done with Rita's involvement, we were out there in this, strange landscape of you have to design and deliver core elective and continuing education courses 100% online for the entire state of New York. And every peer who needs to become certified should have access, and it should be 508 compliant and ready to go. And we were like, sure, let's do that. So it took a decade, but what we've come up with is that when you design using universal design principles, and you make training interactive and engaging, and you pause to allow people to reflect and to test their own knowledge throughout, adult learners rise to that challenge. We also are very, very aware that a blended approach that involves online self-directed learning for adults paired with in-person or virtual support, tutoring, and camaraderie through the learning process is really the ideal. So Zoom has been our friend. Virtual support groups are amazing. A structured lesson plan that the trainers follow so they can replicate the training the same way each time, and opportunities for peer-to-peer learning are really what we emphasize. So I'm going to end it there, John, but I'm happy to talk more with anybody about it. It's what we are passionate about.
Thank you.
And I'll just go ahead and go through our last slides. This is our contact information. So Amy's contact information is here. Mine is here. And again, we will be providing the slides to the SHARE conference. This is access information for the Academy of Peer Services. If we want to put that back in the chat one more time. And thank you very much for attending.
Yeah, thanks a lot. Rita, I wanted to just address one last thing for anyone who's interested in staying on. Laura, Jody, Phil, others have talked about what is the California state requirements for training. I wish I could answer that question. I can't. I know that you all have had your certification process approved very, very recently. And so I don't know what your training options are. What I can say is that the New York State Academy of Peer Services, as I noted, is open source. So any person can create an account and go through our coursework. However, after completing your post tests in the Academy, you would have to check with your certification board in California to see if those certificates of completion could be honored by your state certification body. The other option is that sometimes testing is required by the state in order to pass and be certified. Our courses can certainly help to prepare you in the topical areas of interest. So for example, if you're looking for training on the ethics of peer support, check out the Academy. If you're looking at harm reduction, trauma-informed approaches, person-centered planning, those broad topics that are so important to peer support, come take some courses, and then perhaps your board will allow you to take the test and you can test out. So Rita, who should we direct folks to about the certification in California?
The Cal Mesa is the only organization that I'm aware of. So, and that I don't know a whole lot more than that.
Okay. Yeah, I apologize that we don't have more state-specific information, but I'm sure that the SHARE folks will be able to direct people, or maybe you all can chat together if anybody in our group knows. Direct them to SHARE. Thanks, Jody. Great.
Is that everything
Thank
then?
you so much.
Yeah.
Thank you all so much. Thank you so much to Rita and Amy, and thanks to everybody who joined. If you are emailed an evaluation, we strongly encourage you to fill that out. The next session is mental health peer support in the Department of Veterans Affairs, and that begins at 10:15. So if you want to hang out, feel free, or you can come and go as you please. So thank you, everyone.
Thank you.
Thank you so much. Take care. Thank you, Kathleen.
Thank you,
Thank
Kathleen.
you. Thank you, everyone.
Thank you. Thanks. Great job.
Thank you. I'm excited.
say one more time what you were saying we should fill out?
Oh yeah, so there might be an evaluation getting emailed to you if you provided your email address. And if you'd like to do that in the chat now, that's great.
Wonderful, thank you.
Thank you.
If you wouldn't mind, I just have a quick question. In the beginning, we were asked to keep our video off in these main sessions. Is that going to be true throughout the whole entire day?
No, you can just listen to whatever the leader says. If they ask for it to be turned off, then go ahead and do that. But otherwise, you can just leave it on.
Okay, thank you so much.
You're welcome.
No, good.